Hello, everyone. I'm Dr. Narissa Bauer, behavioral pediatrician and CEO of Let's Talk Kids Health. October is ADHD Awareness Month, and two of the key treatments in an ADHD care plan is behavior therapy and parenting support. Obviously, medication does play a role, but pills don't teach skills, and it's important to include these other two components in your child's treatment plan. As a behavioral pediatrician, I see many families with children and teens with ADHD. And in fact, it's not uncommon for parents to wonder if they themselves might have it after learning about it as they go through this journey with their child or teen. But one of the questions I often get is, well, what type of therapy does my child or I need? And it can be confusing, especially if you hear things like CBT, DBT, PCIT, TBRI, EMDR, PMT. It can be hard to know where to start or what it is even. So I have invited six of rock star guests to come and talk with us about strategies for behavioral therapy and parenting success. There's a lot of myths out there and different things that people may think about, some stigmatizing as well. So I wanted us to have a good conversation about this topic because it is definitely one of the things that your child's pediatrician or person managing their behavioral health care is going to suggest at some point. And it's really important that we have buy-in from everybody. So I thought I would start by first of all asking my guest to introduce themselves and maybe just say their name, where they're calling in from, and what type of therapy they work with families. And I'm going to go and just call on people first. So Karen, since you're kind of right next to me on the screen,
Yes.
do you mind starting?
No, I would love to. So I'm Karen Montgomery, and I am all the way in Kansas City and honored to be here. And I am a registered play therapist and level 2 certified in EMDR and do a lot of CBT in my practice. And I work with kids and their families dealing with ADHD, anxiety, depression, and trauma. That about sums it up.
Yes. Thank you so much again for being here.
Yes.
Emily.
Hi, I'm Emily Bedell. I'm calling in from Indianapolis and my office, EB Psychology. I work with kids. I'm a certified PCIT therapist. I do a lot of DBT and CBT as well. So working with kids as young as about 2 and going up to about like 13-ish. Once they can drive, they're a little bit, we have different things going on then. And so I work with the kids and their families in that age group. And with ADHD, autism is a large part of my practice as well, and anxiety and depression.
Yes. Thank you again for your time and being here at the studio. Jen.
Hi, I am Jennifer, or I go by Jen Meisegland, and I'm calling in from Carmel, but I work in the Indianapolis area. And I also do a lot of EMDR. I do a lot of, you mentioned TBRI, that's kind of our parent framework we use a lot. We work a lot with families and children. We work with adults, kids, but our parents are a very big part of our treatment plan. And often we see a lot of kids with ADHD, neurodivergence, especially with the emotional regulation piece. We also work with a lot of trauma, grief and loss. Adoption is a big area that we specialize in as well.
Yes, I'm so glad to have you back here in the studio. Thank you so much for your time.
Thanks for having me.
Yes. Hillary, Dr. Blake.
Hi, I'm Dr. Blake, and I'm at Woodview Psychology Group here in Indianapolis, Indiana. I do a lot of work with kids who have emotional dysregulation. So I am trained in DBT for children and do comprehensive DBT. And I also do a lot of work with kids with chronic medical conditions. Other types of things that I do is I'm trained in space, so I do a lot of parent-based interventions along with CBT.
Wonderful.
And I work with kids from any age, like 3 to, once you're married, you're out and have kids, so young adults.
Dr. Blake, thank you so much for being here today. Lindsay.
Hi, thank you so much for having me. So licensed mental health clinician specializing in mental and behavioral health with kids. I typically say ages 3 to 12. And most often that includes some form of play therapy. I am a registered play therapist in TheraPlay and I'm trained in brain spotting as well. So any anxiety, depression, behavior issues, trauma. Yeah.
Yeah, thank you for being here, Lindsay. It's really great to have you back in the studio. And then last
Thank
but
you.
not least, Dr. Michelle Thorne.
Hello. Hi, I'm Dr. Michelle Thorne. I am coming out of Indianapolis, also originally from Kansas City. So, Karen, that's amazing that there's a Kansas City representative here.
Love it.
I am the practice owner of Infinity Wellness, and I work with kids from, super duper young all the way through adulthood. So I love working with parents and adults as well, just to kind of deal with their side of things in addition to the kids' side. I love working with people with anxiety, depression, ADHD, behavior concerns, anything pretty much in that world. And also, like Dr. Blake, work with kids that have chronic medical conditions as well. So thanks for having me.
Yes. Yes, I'm so excited. Many of you, I think all of you, have been on either my podcast or my Let's Talk Kids Health live show in the past, or a virtual roundtable. So I love to pull everybody together. So why don't we go ahead and get started? And again, if you're watching this live and you have any questions, don't be shy. Go ahead and put those in the comment box, and we will address those as they come in. But I'm going to kick us off because obviously I had stated that a lot of people, when you say the word therapy, it may cause some feelings or emotions. And I would like to ask each of you, what is the single biggest myth that you hear or feel the need to debunk when it comes to therapy? Who wants to get us started?
I got one.
Yes?
I think the one I hear the most from both my kids and people around is, well, only crazy people go to therapy.
Yeah.
Only people who you have to be really, really have something wrong with you to go to therapy.
Mm-hmm.
I think that's probably the biggest one. I see everybody nodding their head, so I know I'm not the only one that's heard that before.
Yeah. Thank you for that. I mean, I guess my follow-up question is, when you hear that, what do you have to say to folks if they themselves maybe hold that in their minds?
Yeah, I think you start. It's more for people to learn their strengths and learn how to make things work better for them. So while there certainly are people who have a lot of difficult things that they're going through that may go to therapy, there are also people who just want to learn how to make things work better. And so they come and
sorry about that, Michelle. I think you froze just for a little bit. And everybody just check on the chat there, because Amy is just double checking things here. Okay. So let's go ahead, and anybody else have any other?
I'll piggyback off of that.
Yes.
Only because one of the things that I tell people ahead of time is I only see normal people because everybody has a something, and everything is normal. We all have a different kind of a normal. And that's one way that I open things up. But I do also hear parents worried that, what if my kids think there's something wrong with them? Or, what if it makes them worse? And I really explain that they will be surprised that probably the minute their child gets in, they will say, when do I get to come back? Kids are very open to therapy. And when working with kids, we know how to make it fun and engaging so that it is playful, yet still just as effective.
Mm-hmm. I love that. Anybody else have any?
Well, what I would say, go ahead. What I would say goes with that idea of, I think one myth that I hear is like, especially since I work with kids, and that people come in like, what, are you going to put them on a couch and like talk to them? And no, like that very rare will a 3-year-old sit on the couch and chat about their feelings. And so that idea of a therapist who works with kids knows how to individualize it so that the child is engaged, that it is that they want to come back, and that it's a place where they feel safe and where we meet them where they are. Where are we playing? Are we talking? Are we walking? Are we, how are we doing this in a way that is meaningful and joyful? I think, honestly, for the people who are involved, whether it's the parents who do want to sit in the couch and talk, or the kids who want to sit at a dollhouse and start going with it and do whatever they want there. So I think that what does it look like? And the myth around the different myths about what therapy looks like gets people kind of caught up.
Mm-hmm. Jennifer,
I
think you were.
Yeah, I guess I would just add in also, I think oftentimes there's the myth that, especially when working with children, that, therapy is we're going to bring the child in, have the child pop in, pop out. And it's really, parents are a big part of therapy. And so trying to set that up ahead of time, sometimes that can be a little intimidating, but really trying to set up, come along as we're a support person for the parents as well, because that's a really big part. I think that's a myth I hear. And I think I also hear, well, my kids have coping skills and they don't use them, right? And so often we spend a lot of time where coping skills are important, but we also need to help them understand and help the parents understand what needs do they have to be able to access the coping skills. So I think those are some pieces that I spend some time on, usually in the beginning, to with some psychoeducation.
Mm-hmm.
I was going to chime in and say, also kind of piggybacking off of Jen, I think you get a lot of myth, especially kids with behavior problems, that you drop them off and then I fix them and then you're done. And I always tell families I don't have a magic wand. I wish I did, but it really is encompassing the entire family, parents and kiddo. It's not just kiddo with behavior problems.
Mm-hmm. Yeah. One of the ones that I hear is that, well, we've been going, but it sounds like she's learning something, but then when it comes to it in the moment, they can't access those skills. So why should we keep doing it?
Yes.
Or they're just playing.
Yeah.
And I'm not sure that it's worth our time.
And that's why I love to front load on psychoeducation, to help them understand why they may not be able to access those skills and how to prepare in advance. And I think that's where we have to include parents and other adults that are working with these children.
I would agree with that wholeheartedly. And that's where you bring them in to start doing role plays and let's practice these skills when they're not already keyed up.
Right.
Mm-hmm.
Yeah.
I think that's a good segue into our next question. Because oftentimes when parents or kids have these misconceptions, and all of you have said that it's really important to meet the child where they are, do a lot of that front loading, talking with the families about what to expect. There is still some non-compliance, or if a client themselves is resistant to therapy, how do you handle that? Anybody want to jump right in with that?
I guess I'll jump in since I'm next to you. I often, I want to discover what is it that's going on that they are resistant to. Is it the fact that their parent's in the room and their parent is not a good co-regulator for them, or they don't feel emotionally safe? Or is it that they're not in a place? And so if a child is not in a place where they want to be engaged in therapy, I say, well, we can still do therapy without your child even being here. We can do parent support sessions. That might be the best way to start to normalize this, and to start implementing skills and to help them raise their baseline a bit before they come in, or do therapy in shorter sessions. There are lots of different methods that I might use depending on the child.
I'm seeing a lot of nods.
Yeah, I think I would just piggyback on that as well. I think it's that safety piece that, I always try to step back and assess if the child is feeling safe, is there felt safety, is there felt safety in their environment at home? What is happening that's not allowing that comfort level to come in? I think that's the first piece. And then I think also, checking in with the parents as well, on what their expectations are of therapy, and helping them really understand maybe their window of tolerance, maybe 10 minutes of really good stuff. And then I'm going to sandwich that with some games. And I think it's helping them understand, they're coming alongside you to know there's a reason for that. We're trying to expand their tolerance of what they can allow. And I think the psychoeducational piece for parents, I think, is so important, just so they understand what's happening. and they can understand what their child is needing and why it might be slower than they anticipate, or why you might be doing this type of thing, or why you might be playing here or doing that. And I think setting that up ahead of time is really important as well.
I would add to that the piece of, if you've got a child who says, I don't want to do this isn't for me, it goes right back to the first part about myths. So what have you heard about therapy? What do you think about it? And maybe it's a matter of normalizing that piece before they come in. I don't want my friends to know, or I think, this must mean I'm bad, or I have something wrong with me. And starting there can really get them on board with what program you're trying to implement.
Yes, and making sure that parents aren't using it as a punishment is, I think, another big thing. This is to help you, and you don't have to talk about anything you're not ready to. Giving them a little bit of control is really important, and teaching parents too, not to say you're going to therapy because you're bad or this or that is going on, but we're going to so that we can all get better and use our brains in the way that works best for us.
Mm-hmm. Yeah. And I would say with that, and this is maybe a more aggressive approach, but sometimes I work with that motivation and roll with that resistance of, you don't want to see me anymore. Like I've assessed that you are in a safe situation. We're doing the parent support piece, and maybe we're getting into some things that the kid's like, I don't need this. Like, I'm fine. And I always follow directions, and I never have any tantrums of any type. And I'm perfect in every way. I'm like, great. I would love to see the data for that. So let's come up with some guidelines of, what do you think your parent would need to see for them to be like, you don't need to see Emily anymore. You're good. So then we kind of come up with, what would those benchmarks be? Maybe it is that, I am not destroying any furniture in my house for 21 days. Maybe we're not trying to say I will be perfect in every way, but that idea of what are those measurable and observable ways that I can tell that someone is more regulated. And if you're able to do those things, then girl, you go off and you grow and you thrive, and I'm here when you need me. So sometimes rolling with that resistance and let's make a contract, and let's see what it would need to be, and working with the parents. And sometimes if the parent buy-in isn't there, where I usually equate it to a workout routine, that idea of if they're coming in, and then that idea that Hillary mentioned about come in and fix my kid and, peace out, that it's okay, well, if you eat one salad, you're not going to go down in 3 jean sizes. That's just not how it's going to go. But if you are consistently engaging in these healthy behaviors, you will see these changes. So, talking about the parent buy-in and how consistently they're willing to engage in the methods. And if it's not consistent, then let's dive into that and see what's going on and what are the barriers. But whether you're rolling with the resistance or providing more education around, this is the timeline that I would need you to try this to know if this really isn't the right approach, and going with data a lot of the times when it comes to behavior.
I also use a lot of, I wonder if you're afraid that you might tell me something that's going to make me think differently of you. And there's nothing you can tell me that's going to make me think anything differently of you. And everybody has a something. And then I also pivot to trying to stay in the metaphor more. Maybe they just aren't ready to directly talk about themselves. And that's where I use a lot of bibliotherapy, or, I know you don't need this help, but I have this other client and I am just stumped. Can you help me figure out what might work for them, since, all this stuff is working for you?
Yeah, I do a combination, I think, of what everyone's doing. I do think, though, after I've tried everything and everything's failed, I will sometimes, especially for teens, when teens are hardcore, I don't want to be here at older ones. I will just say, come back when you're ready. If we've done parent work, mainly because we've all had those clients that we've tried every technique and they still don't want to be there. And at that point, you don't want to ruin therapy for them. So I usually have a talk with parents of hey, your child obviously would benefit from this, but I don't want to leave a bad taste in their mouth. So there have been, for my highly, highly resistant patients who I have tried everything in the book and I still can't get buy-in, that I just say, let's just stop, because I really don't want to ruin this for them, because I know how beneficial it is long-term.
I think that piggybacks with being able to say to them that, hey, if we don't click, that's not going to hurt my feelings in any way, shape, or form. You have to have a good relationship with me to be able to work with me and get anything out of this, because otherwise you're not going to get anything. So if that's not me, let me help you find that person.
And I love to give them something tangible too. I say if the time isn't flying by, then I might not be the right fit. If you're looking at your watch every 5 minutes going, when is this going to end? It's a sign that we either need to start spreading sessions out, or I'm not the right fit and let's find someone for you, so that they feel like they have a way to maybe measure that or figure out what that might mean.
I'm curious because you brought up the fit. I mean, and in our podcast episode, we've talked about that as well. But have any of you also had that conversation, like just not feeling that fit and having that discussion with families? Yes.
I start every first session with somebody saying two things. We talk about confidentiality, and the second one is if you don't feel like you can talk to me, or you think I'd like, Mom, that lady is crazy, then let me help you find who you need to go to.
Absolutely. And I do the same thing in the intake. I say, I may be gathering information about you, but you're interviewing me and you're telling me if I'm hired or not, because this has to be something that you feel comfortable with. And at the end, I'll say, you don't have to tell me right now. You can talk about it in the car. Usually they'll go, no, you're hired. So
I love
making it playful too.
I love that. Because I think sometimes parents are not quite sure, they're kind of like, well, we've been going, I'm not sure she's really opening up, or he's not really, like, what do I say? How do I say that? I mean, would your feelings get hurt if a parent said that to you? No.
No.
Never.
No.
I think generally we feel it too on that side, like, hey, this just isn't that click. If it's not there, I'm not giving you the best of what I have either, if you don't really feel like you're comfortable here.
I think that's a really valid point.
Yeah. And I think we're always modeling to our parents, right? I feel like everything I'm doing is modeling to them of, yes, there's a fine line of we have to, there's certain things we have to make sure our kids do, to take care of themselves. But at the same time, we really want to show that we've been assessing the kids and what they need. And like Dr. Blake said, I think if we are at a point where we've hit that point, part of our job is to say, okay, let's look environmentally. What else can we do? What else? Because we really want to be showing this kid that we advocate, we hear you, we see you, and we're modeling that to the parents because they've entrusted that in our care. So I try to take that approach as well, as when I know when it's time, and if it's time for a different fit, right? Then I want to make sure they understand you can share that with me. This is not a personal thing. This is about what's best for you and your child.
Lindsay.
I think everyone has yeah. Yeah, I was going to chime in that I think everyone has articulated so beautifully all the possible ways that through some of that resistance, and definitely have tried all the above as well. And sometimes when you've tried everything, like Dr. Blake said, I have framed it as well, let's take a break. And even just saying that has made some clients pull back, what do you mean? It's well, I don't know that, maybe you don't want to be here and we should take a break. And sometimes that is enough to generate some motivation. And then sometimes we just genuinely need to take a break.
Yeah.
Well, I would agree with that. I think boundaries can sometimes be a natural therapeutic change sometimes, right?
Yeah, for sure. And I know, right now, just getting into therapy is challenging for families. There's oftentimes long wait lists, and other factors that they have to consider when they're trying to find a therapist. And I know sometimes parents get a little discouraged, especially if they've waited a long time and, their child's not interested, or they're just having a hard time connecting. And so just to kind of be mindful that parents, you can absolutely, have that open and honest conversation with the therapist, because ultimately we want the best for your child. And if they're not going to engage at all, we need to kind of find the right fit. So
absolutely.
So I'm just curious, because I think we started off this session by, I threw out the alphabet soup here, but I'd like to ask, because I know all of you do similar things working with families. Some of you use different frameworks, but if you had to explain what you do to a stranger in 2, maybe 3 sentences, what would you say? Because I'd love to hear from each of you because I know what each of you do, but if you had to explain it to a family for the first time who's like, I don't know, I just was told I need CBT or DBT or, like, what is that? But I think I'm at the right place. So I'd really love to hear from each of you. And may I just call on you? Okay. Can we start with, why don't we start with Lindsay this time?
Yeah, sure. This is a really great question, and kind of, I think sometimes I was thinking it depends on the stranger. I respond to that, but beyond just like my basic like alphabet soup and certifications, I would say that I'm going to be telling them that I work with therapy. Most of what I do falls under that umbrella, and sometimes it's directive, sometimes it's non-directive, sometimes it's more CBT-esque, where it's like, let's make a coping skills toolbox. And sometimes it's, sand tray, and there's metaphors, and we're processing through that. So there's a whole variety, and really try to make it individual to the client's needs. And this.
Mm-hmm. Can I ask you? I mean, once you start with a child or a client, and they're working with you, and you're getting to know them, the family, do you ever pull out other techniques or switch course from what you first set out
Yeah,
to do?
absolutely.
Mhm.
Absolutely. So, for example, if I started out with very directive, prescribed technique, the parent and child, and maybe we've done that, there's been progress, but it's plateaued, then we reevaluate, and maybe we shift to a more non-directive form of play therapy to see maybe that the child would engage differently that way.
Mhm.
So
Yeah,
yeah,
and
absolutely. We just shift
and
gears.
just because folks watching this may not know what TheraPlay is, can you explain that a little bit more?
Mhm. Yeah, so it's a parent-child relationship-based model. When the kiddos are like 3 to 5. The parent is directly involved in the therapy, and is like first a witness to these very like on the surface very simple activities that all have an underlying message that's being reinforced through play. And it's helpful for attention span regulation. Um, the child, those kiddos that are trying to always be in control and need to be able to take care of them, things like that.
Mhm. Thank you so much for that. How about we'll go with Dr. Michelle Thorne.
So, I think you would definitely have times where you switch different techniques, but I think I usually start, if it's somebody who's brand new to therapy and they don't need all the numbers or the letters and all of that, I will talk to them about, I got into this field to be able to talk to people, help them figure out what they do really well, and use that to help them in some of the areas that aren't going as well. So what can we do to help make life a little easier? If it's a kid that's coming in to see me, I usually tell them what I used to get in trouble for in school, and that was talking too much. And so now I made a living, and I get to sit in the living room and talk to people and help them through their day and learn about their life story. So depends on the audience, but that's usually how I say it.
I love that. I love that. Anything else that you want to add? Because I know that you really love working with the teens. You love doing anxiety,
There's not much I don't love. So I think I would be really hard pressed to pick one group or one small thing, because I just love getting to meet people. So I love the little guys, I love teens, and I really like working with parents too. So all of it.
Yes. Yes. Thank you. Um, Hillary, Dr. Blake.
And I was like, I guess it depends on what you get referred to me for. But I would say most people get referred to me for DBT as a big referral from you. So I'd say if that's what you're referring to me for, I usually say, like, to the kid, you're here to learn to be the boss of your emotions, and to teach parents that they no longer have to walk on eggshells, and help them feel confident in their parenting skills.
Mhm. I love that. Yeah. Can you briefly just mention what DBT is? I like how you describe it to the kids, but can you just briefly mention what that is?
Yeah, so DBT for Children is an offset of DBT. It was created by Francesca Paraplechkova. So, comprehensive DBT for Children involves parent training, individual therapy, skills training, 24-hour access to me so they can generalize skills. So, I'm on call all the time for families. And then I also have a consultation team that I meet with every week. So, it's a lot. And that's what I tell families too.
Yes, yes, yes. And I tell them you're one of the few people in the state that is certified to do this with kids.
Yes.
Yes.
I am. Yes, yes. And I think the glorious part about DBT, especially for DBTC, is we don't need commitment from kids. We get commitment from parents. And so we work with parents primarily, and kids, when you think about treatment of behaviors, is like last on our hierarchy. So we're always hitting parents first. So
Can I put you on the spot because I also know that you offer space? Another.
yes.
Can you talk to us
Yes.
about what that is too? Because
I love space. Yes. Space. We're not getting on spaceships. Everyone asks that. Space is a parent-based intervention for anxiety disorders such as OCD, generalized anxiety disorder, separation anxiety, selective mutism. And it teaches parents essentially how to handle their child's anxiety, how to be supportive, and then no longer accommodate the anxiety. So it is great for those kids who don't want to come to therapy. Was actually why Ellie Leibowitz created the treatment, because they had all these kids who didn't want to come to treatment. And so it has been found to be as effective as CBT, which is the number one treatment for anxiety, which is pretty amazing.
yeah, I actually had the honor of interviewing him because we did that as a parenting book club, and his book is fabulous. So yeah, and I'm really glad that you offer it. How about we go with Karen?
Okay, well, I actually tell people I have the coolest job ever because I get to help people find their best self, and I get to help people rewire their brains all day, which is essentially the neuroscience geek in me and the EMDR, where we have this superpower of neuroplasticity, and there's never a time we can't change. And so we can always do something. Like, there's no one that can't be helped, and you can't do it wrong. And what's right for you might be different for someone else. And then I love the fact that kids find out through therapy that they're not alone, because people only show the outside. And that's one of the reasons why I wrote my recent book, was to let people know that other people feel this way too. In fact, we all have feelings, and we all have an invisible riptide. They may look different, and we might have different worries, but everybody has a something. We just don't see it. And so helping just really normalize that, and that also teaching them the purpose of their feelings, and just helping them live their best life, and communicating with parents and creating a common language.
I love that. Sorry, if you hear squeaking, my dogs are kind of decided to play right now. So yes.
That sounds about right.
Yeah.
For my house, at least.
Yeah. So, and I'm so glad that you mentioned your book, The Invisible Riptide. So thank you so much. Yeah. And at the end, if we have more time, we'll definitely kind of go into just other things. Okay. Emily.
Yes. Okay. So 2 sentences. They're going to be run-on sentences, just so you know. I would say that my goal is really empowerment, whether it's empowerment of the kiddo to really own what they're feeling and take control over how they're expressing it, or empowering the parents to really feel like, I am good at this. Like, I am the right person to love and take care of my child. I have it. That I know my mom told me, like, the only person with a stronger will than your daughter is you. And she's like, I know that because I parented you. And I think that, like, you're there for your kiddo, and that that my job as a therapist is to help you feel empowered and your child feel empowered to face challenges as they come, because they will, experience all the joy that, you know, there is to offer, but know that those moments of joy, there will be challenges after them, and those challenges are temporary, and we are equipped. We know what to do. And when in doubt, I can trust kind of my gut. I can trust what I've learned, lean into that, and do better next time. And you know, I really, like, if I had to do it in one word, it would be empower, because I think as parents, we doubt ourselves frequently, and we always think we could be doing a better job. And that's what makes us so amazing, but also that it just makes it difficult, and that what parents feel isolated when they have these challenges. And I don't want isolation to be a key feeling. And I want that to be something that dissipates when you come into my office.
Nicely said. Nicely said. I mean, I can't tell you how many times I hear parents say, you know, gosh, there's this guilt that I carry around. Is it something that I could have done differently? I don't like to act this way, right? So I think that's a huge piece of helping to normalize and empower the clients as they come in.
Mm-hmm.
Yeah.
And I think normalizing that everyone makes mistakes. And, you know, I'm a therapist, but I make mistakes with my kids, and kind of reducing that power differential to reduce some of the guilt so that they open up more, and aren't maybe as defensive or feeling defective or ill-equipped.
Yeah. And I think that, like, just that statement of when parents do say, is there something I could have done differently? Or did I do this? And the amount of shame that is expressed in that moment. And I feel so honored, and that somebody would share that, because those are those thoughts that go in our head that we don't say out loud, that you think about when you're in the shower and you're like, oh my gosh. And so I think honoring that moment and honoring the strength that it took to share those thoughts, because as a parent, you don't want to feel like you're doing a bad job, and you don't want to feel like you're the one that is causing this. And so to even just ask that question, I think, is really powerful. And then, of course, match it with that education of like, no, like we just, you know, this is the kid that you have, and we need to embrace the kid that you have and work with it. And work with whatever those challenges and those strengths are. But I think that the shame and the guilt piece are something that parents bring to the table that sometimes kids don't have the insight to have. Other times they are expressing that, but that grief that comes with sometimes parenting a child that isn't the kid you expected, and then feeling bad about that. So I think all of that's important to acknowledge in the room.
Even the fact that you asked the question tells me the answer is no, because if you weren't doing it right, you would think you knew everything. And because you're saying, I don't know, this is showing that you care. And so you're doing it because you care and you're open to learning. So the fact that you ask it is evidence that, no, you're not a bad parent and you're here.
Yeah, I say that. I was going to say, you're here. You're sitting in my office. How are you a bad parent? Is usually what I say.
Yeah. Yeah.
I always tell them I was a way better parent before I had kids. I knew everything. And then you have kids, and then you're like, oh, even though I'm trained for this, they're still going to throw curveballs at you. And it's okay. Like, we're all going to, there are plenty of times where maybe I don't parent the best way that I know how, but I'm continuing to try to get better. To Dr. Blake's point, that you're here, you want to get better. That's the most important piece.
Yeah, and I think it also helps. We teach a lot of validation in DBT, and part of PMT and a DBT framework is we teach self-validation for parents. And so we work on catching judgments using mindfulness in session with them and teaching them how to validate themselves. So, hey, let's reframe that, right? I hear some judgment there. How do we flip that? How do you use your describe skill? Tell me how you validate yourself. Because by modeling validation, right, then it teaches validation in the child too.
Yeah.
Well, in repair, you can always go back. That's the beauty of the brain, and why I love to front load on psychoeducation.
I also think that when you're all the stuff, I think for me, like, if I was just get to answer that question, it would be really, I just want to come alongside and provide that support for you as you're navigating some really hard things. And I think that goes for the parents as well. And I think when we're talking about the parents, a lot of times it's spending time asking them, what do they need, right? We're talking a lot about the child, but in order for them to be able to meet the child where they're at, we've got to really look at, what are you needing? And a lot of times I think that's where you do see some of that shame, or also just there's some caring and caretaking we're doing also for the parents because that has to happen first, right? What's their window of tolerance? What's their bandwidth? What's their capacity? In a way that's non-shaming, but more of, we need to help you because we have, just like we have expectations of your child, we also have expectations of parents. And if they're above what they can do in that capacity, then we're just adding to that. So I think for me, it's really just building a relationship with them and helping them understand I'm here to walk alongside you. Obviously, there's lots of tools and modalities and all that, but really building this relationship as you help your child or help the family, you know?
Mm-hmm. Yeah. So I love that, Jen. I mean, while I have you, because I was going to ask you the question, how would you explain? Because
it looks like we have a question. Do you guys want me to read it out loud and then people can answer?
Oh,
It
yes.
says, I have a 10-year-old with ADHD and anxiety being treated both medication for both and has made improvements with both. As his anxiety has improved, he's also seemed to have gotten more outspoken and maybe more impulsive socially. At his age, he's also getting more impressionable by peers, and I feel like with his tendencies to people please because of anxiety and his impulsiveness due to ADHD, that he is even more prone to getting pulled into inappropriate things / peer pressure, and then often feels badly about it later. I'm not sure the best way to help him through this. Any advice? I don't know who wants to start.
Well, I think that advice would be, we learn the most from mistakes and experiences. And, sometimes when our kids don't do something right, they actually are learning the most. And that we can help by role playing and doing a bunch of different things. But I think the important part is for them not to feel your doubt in them. I think one of the most underrated things is having your child catch your confidence in them, even if you have to fake it. Because when somebody's in a bad place and they feel that maybe they can feel your anxiety or they can feel you don't believe in them, it kind of perpetuates it. And so just let them catch your belief in them and catch their calm and find a collaborative approach, so that everybody's on the same page and speaking the same language. And sometimes it's a hard year. And it's okay sometimes for things not to be okay.
Mm-hmm.
Yeah, I would.
And to consider developmental age.
Yeah, I would also start off, right, of, hey, I get that you really want to fit in with your peers and it's hard to control your body at times. And then generally what I do from there is process with kids of like problem solving, what can we do next time this happens? And then role playing that scene with them and getting them to use skills and things they're learning in treatment.
Mm-hmm.
I would add to that, Dr. Blake, and add that expectation management. So I work with a lot of kids that with impulsivity, or that it's that if I didn't see it coming, I may have a really strong reaction to it. It may trigger me in a way that I wasn't prepared for. So if I can think ahead of time, this is what a potential interaction with a peer might look like, or here's some possible things that come up. What are some words I can say? Or if I don't know, how can I deal with that? If somebody asks you a question that you don't feel comfortable answering, just say, let me get back to you. Let me think about that. Giving them the ability to pause, because that people pleasing is like, here, I want to fix it. Instead of like, give yourself a second and just go, let me think about that. And the more they can process that in difficult situations, the more they wind up not just jumping into something they can't back out of.
I love that. Thank you. I love that. Anybody else?
Well, I think I would add to that sometimes looking at the timeline of the events when he's, struggling with peers, of like, is there a common environment? Is there a common pattern to this? Does this always happen on the playground, or is this always during free period? Or so that then, you think through, okay, so we've rehearsed this, we've role played this, I feel ready, but like, I don't know when this moment is going to happen where I'm going to be tempted or I'm going to impulsively engage in this behavior. But sometimes if you can think through, okay, it always happens at recess. So I need to be kind of on high alert at recess, that if I go over to play soccer, sometimes I punch kids. Like that's it. It's a rough spot for me. And so knowing, okay, is there anything I can change about my environment to give me more, kind of set myself up for more success? Maybe I need to just not play soccer for a minute, or I need to talk to myself before I play soccer and say, okay, so sometimes Susie shoves me and I want to shove her right back, but then I feel really bad about it afterwards. And so whether they can, the data collection period with kids, I think is really important, that there's a lot of things that are going on that, like, yes, it looks like you just impulsively did something, but there were all of these things happening around you. Like, let's draw it out. Let's show where everybody was. And, so that, ooh, Susie's coming at me. That's going to be a moment where I need to use my skills, that we have to know when to use them, and we have to set ourselves up to use them. Because if it feels like this feeling is coming out of the blue, you don't feel like you have much control over it. And then you're not going to use any strategies because you didn't see it coming.
And really teaching the purpose of feelings. Like, is this feeling a need to connect? Or is this feeling I'm hurt? Like, what is it trying to tell you, and helping kids learn to listen to their bodies and how their feelings present? Because it's different for everybody.
Yes, absolutely. Absolutely. So thank you for that question, to the viewer who is watching and asked that question. Thank you so much. I hope we were able to give you some ideas to think through. Okay. So, we're kind of
Our
getting
host
close.
has having trouble. So do you guys want me to read the last question she had for us?
Oh, is there another one?
The last question she had for us is, what is the single most important skill or strategy you think families should know, understand, or practice?
Do you want me to start?
Sorry.
Go right ahead.
I was going to say, sometimes it's to not do anything other than be present, get on their level, having them catch your calm, and letting you be a natural regulator for them. And sometimes certain things don't need to be fixed. But I think one of the biggest things we can do is show up and use our own regulation skills to help our child regulate. And to ask in advance, if you're feeling this way, do you want to be touched, or do you want to talk? Because every child is different.
Karen, I love that, because Jen, there's so many strategies, right? But to identify a single most important one, I was kind of along the same lines where I thought mindfulness, because they're not to take a turn on the conversation, but there's a natural norm for so many parents to be in such a state, and mindfulness, they can improve. We can improve our own regulation, and therefore our responses to our.
Absolutely.
And I think I would just add that a lot of times it's knowing what your capabilities are, what skills developmentally, what your child can do. Sometimes we have expectations that we just as parents have, and we don't even take the time. Like, I know I've done that. Check in. Where did that expectation come from? Right. So is that from my how I grew up? Is that from social media? Is that from a friend? And then, because sometimes that could be a mismatch for our kids, right? Our kids may not be developmentally there. May they not be, every 15-year-old's not the same. Every 8-year-old's not. Then when you add some neurodivergence in, there's also some other executive functioning skills. So I think we have to make sure we are really accurately assessing our child's capabilities and their skills and their ability to meet those. I usually use the example of math. I would not teach algebra to a second grader, because their brains aren't capable right now. Every once in a while you might get one, right? And it's the same way I think we have to look at that with emotional health as well, is making sure is this a realistic expectation, or is this something as the adult I need to make sure I'm checking in with myself. What is that saying? What am I needing right now to be okay with this behavior? Or do I need to go down a little, or do I need to increase the challenge a little? Do I need to go down a little bit? That's, for me, a really important piece, I think, when we're assessing and helping our parents kind of assess their kids' needs.
And definitely not comparing. I think the pandemic is something that people don't want to talk about anymore. But when you say, oh, but my child at this age was doing this, well, they didn't miss out on crucial developmental periods. And so considering that, as you say, adjusting expectations, and no child is the same, and everybody gets there, and everyone has a different pace. So not comparing and adjusting those expectations.
I would add perspective taking. I think one of the biggest skills that I want both my kids to learn and my parents to learn is how to take each other's perspective, understand where they're coming from. I think a lot of kids or parents will say like, well, they did this on purpose, or they're try to put yourself in their shoes. What's this big emotion? What's it saying for them? And that goes along with Dr. Blake talking about validation before. Like sometimes they just want to be heard. I know you're feeling so strong right now. What's going on? How can I help you? That doesn't mean I'm not going to parent you and help correct this. Let me just acknowledge what's going on for you right now.
And I think that behavior is communication, and sometimes kids don't have the words, and so it's trying to help them figure that out.
Yeah, Karen, you stole my self, so I came up with a new one. I was trying to think, what else would I say? And I think the biggest thing that I have discussions with parents is acceptance of their child, of who they are. So we always give an analogy that Francesca gave to us during DBT training of she had a parent who was in the office, and he was talking about his son becoming an athlete and chiseling his son into Michelangelo's David. So what we say to families is, you already have a David. You need to learn to love your David as they are and accept your David as they are.
And passion is purpose. So let them guide that. It's not for us to choose, even though we want to sometimes.
Can you guys hear me? Okay. Awesome. Okay. So I want to make sure everybody had a chance. Jen, you were muted. You were going to say something, I think. Oh, no, it's not connecting. Oh, there. Yes.
Yeah, I think I was just kind of echoing again something that I think Karen had said. I was echoing, but I think we're all kind of in line on that important piece. I think what I was talking about with parents is a lot of times I think sometimes we come alongside and we provide them the support of because there's a pressure for our parents, right? They're to be doing A, B, and C, and this is what they're supposed to be doing. So sometimes the relief that they get when you're like, it's okay that they're right where they're at, because they are living in this high stress culture of do this, do that, keep up with this person, do that. What if they're not doing this? It's a lot for our parents. And I think sometimes just giving them the space. And then I think when you're talking about, a child that may be, have, bigger emotions or may not fit in what we can call so-called normal, which I don't really love that, but that's what society might look at it is allowing them the space to have some time. You mentioned earlier, Emma, about grief, right? Some grief about that to help them come along to who their child is, and that they really do get there with our support. I think it's a big, important piece of what we all do to provide them in a culture that's really tough sometimes for our parents, I feel like.
Yeah. So in our last few minutes, I want to sort of invite each of you, if there was anything else that you wanted to say about what you do, about therapy, working with families that we haven't already mentioned, or you just want to drive home for our watchers, listeners. Is there anything else?
I love teaching when we're emotionally flooded, we're offline. And so it's really helpful to focus on facts and not feelings. And I love to make little cards that are laminated with just a few reminders to help people kind of get out of the cycle, so that they can, have them at school even, or their teacher might have one, or the school counselor and the parent. So it creates that common language and stops you from getting caught up in this never-ending spiral. And when your brain is hijacked, you can't think. So it's really helpful to have a couple things written down, or the top coping skills that you can use that are easily accessible and tangible. So that's something I love to do.
I think one piece we've kind of talked about a little bit, but coming alongside, I think, Emily, you mentioned that idea of coming alongside, but that we're your team. So you've got a team of people working with you. This isn't just you. The idea of it takes a village, I think, is so important, that most of us are parents ourselves, or at least work with a ton of people who are. It's not easy. There's not rocket science. There's not one specific way to do it. Our job is to help come alongside and be a part of your team.
Yeah, I love that. I think one of the things when I'm, teaching my course, I often will tell them the different parts of a care plan. And I tell them, the one part that is part of this is parenting support. Now, it's not something that the kids have to worry about, but I want you to know that even parents need some help and guidance. And it's not, because I think sometimes the kids they're the ones seeing the therapist, they're the ones seeing the doctor, they're the ones going to the tutor, like, and they often feel that there must be something about that they're not living up to or whatever. And we don't live in vacuums, and we have to learn to connect and communicate, and even parents need help too.
Yeah. And saying that it's really cool because I get to help your parents with things that maybe you don't like. Like, this is exciting because if there's something that's not working for you, I get to help coach them too. So this is for you, especially with those more resistant ones.
Yes.
I think I would just, the last thing I would kind of add is just as a reminder that behavior is, it's information. It's information for us to know what to do with. And underneath that information are needs. And in order to get that behavior to settle, maybe I like to use the window of tolerance, because again, every kid's a little bit different of what there is, but really in order to get them in their optimal space to learn, we really have to know what those needs are. And the behaviors they're just more loud, right? Loud, either they're dormant or they go loud. And I think we have to almost be detectives for what's going on, what are their needs. And that looks different for each of our kids, right? If we have a couple kids, each one is different. And that's what's hard sometimes. But I think that's really important to know what's going on. That's this information that we're getting, and what do we need to help them to be able to reach where they want to be.
Mm-hmm. Well, sorry, Lindsay, were you going to say anything?
Oh, yeah. I mean, I was just going to kind of echo what everyone else had said. And Dr. Bauer, I love that you include that parent piece in your work that you do, because that parent involvement, parent support is so crucial. And it looks different depending on the age of the child and being met. So sometimes it's parents in the session with the kiddo. Sometimes you want to safeguard the relationship with the kiddo. And so sometimes that conversation and follow up and support for the parents needs to be in a separate scenario, separate session, separate conversation. But that, the parent piece is so important, and hopefully parents feel that, that we're there to support the kids sometimes.
Mm-hmm.
And I think with regards to not having access to therapists, one of the things when I do teacher trainings is advocate for parent education, because the parents are crucial collaborators. And I think that's one thing, it's only easy when you know how, and you can't know what you haven't been taught. And a lot of people in our generation weren't taught about these things. And I always say, I only know because this is my job. And so just pushing for parent education, even outside of the therapy, the room, I think is something we really need to advocate for.
Mm-hmm. Mm-hmm. Well, this has been a wonderful conversation, and I really appreciate all of you giving us your time tonight to talk through this and share your expertise, your wisdom. And as always, if you are so moved, check out the past episodes. All of these wonderful people were on my podcast or previously on my channel. If you search my YouTube channel with their names, you will find the trailers. You might even find their full-length episode, depending on when we were recording. But please make sure to check those out, because they are a wealth of information, and all of their individual episodes have links to their websites, their practices, and what they do. So please do check that out. And if there's anything else that you wish for us to talk about in future virtual roundtables, don't hesitate to reach out. I always love to get those kinds of questions. It gets me thinking about who else can I invite and have some really great discussions. So thank you all for joining. And for now, we'll say goodnight.